Hello everyone. Let's discuss today about Ksharakalpana. Here we are going to discuss about the introduction and etymology of Kshara, types of Kshara, method of preparation, dose and shelf life, Ksharasootra Moving to the introduction, Kshara, it is the alkaline substance obtained from ash of the drug. Here this kalpana is having more penetration power, that is, it is much sukshma and will enter into the srotas much quickly. If we consider the therapeutic role of Kshara, it is having much implication in Shalya and Shalakya conditions. And it is very useful in case of surgical contraindications, where the surgery is contraindicated. There, in that condition, we can apply Kshara. And it's used better for women, children, and for those persons who are afraid of surgical intervention. And it controls bleeding and reduces the disease recurrence chances. Also, the chances of wound infection are very rare with the use of Kshara. If we consider the etymology of Kshara, Ksharanath, Kshananath va Ksharaha. Ksharana, it is the cauterizing effect produced by Kshara, and Kshanana means it will kill the tissue. So, the etymology is Ksharanath, Kshananath va Ksharaha. If we consider the types of kshara, depending upon use, we can consider it as paniya kshara for internal administration. Those are mild type of alkalis. And pratisaraniya kshara for external application. Those are caustic alkalis, much more potent. Depending upon the sankhya, that is, different groups of kshara are there categorized into different groups. Dvikshara, that is, sarjakshara and yavakshara contributes dvikshara, and trikshara, if tankana is also combined, it is called trikshara. Then kshara panchaka is there, kshara ashtaka is there. Then types of kshara depending upon source, we can consider it as three: Khanija, Pranija, and Vanaspatija. Khanija can be again categorized into naturally obtaining and synthesized form, that is Kritrima. Naisargika kshara examples are Sarja kshara, Surya kshara, etc. And for Kritrima, we can consider sodium borate, Tankana kshara as an example. In case of Pranijakshara, those alkaline substances obtained from Shankha, Shukti, Varatika are known as Pranijakshara. And those kshara obtained from plants, that is Arka, Palasha kshara, etc., are Vanaspatija kshara. Depending upon the strength of kshara, we can consider it as Mrudu kshara, Madhyama kshara, and Tikshna kshara. If we consider the method of preparation, first of all, we have to collect the plant from which we are going to collect the kshara. It has to be dried well and burnt, and the ash is to be collected first. Then, this ash should be dissolved in 6 times of water, cow's urine, or a mixture of both. This is the opinion of Sushruta Samhita. The ratio differs if we go through the textbooks like Yoga Ratnakara and Rasa Tarankini. There, 4 parts of water is mentioned. So you should kept in mind this difference, ratio difference that is seen in these textbooks. Here, then this mixture is stirred well, and we have to kept it undisturbed overnight. An opinion is there according to Rasa Tarankini, that is, this mixture should be macerated well for 1 yama. Next day, that is, we have to collect the supernatant fluid, and the sediment the residue should be discarded. Only the supernatant fluid is collected. It is filtered for 21 times. This filtrate is then boiled in a large iron vessel with constant stirring. This is subjected for further boiling until all the water particle evaporates, and we will get a paste or dry powder form which will be called mridukshara. So, this is the reference from Rasa Tarangini. Kshara vrikshasya kashtani dagdhva bhutim samaharet. Kshara vrikshasya kashta, the plant parts should be burned. Dagdhva. Bhutim samaharet means the ash should be collected. Vimale bhajane nisya salilantu chadurgunam. We have to add 4 times of water by keeping this kshara in a clean vessel. Vimale bhajane. Then we have to perform maceration for Yama Matra, and this liquid is filtered through a three-layered cloth, and this filtered cloth is then heated in fire. That is, prakshipya mardhayet samyak yamamatram bishagvara triguneekrita vastreena sravayet salilam tataha sravitam salilam chada vannau santapayet tadaha nishesham salilam jnatva. All the water particles should be evaporated. Then nirmala kshara maharet. We have to collect the pure kshara particles. So this is the preparation method for mridu kshara or paniya kshara. In case of madhyama kshara, we have to add 1/10 part of burnt limestone, shankha, shukti, etc. in order to increase this cauterizing effect. And in case of Tikshna Kshara, there some plant drugs should be added. That is Danti, Dravanti, Chitraga, etc. And some minerals like Pravala, Vidhalavana, etc. are added. This addition of extra drugs increase the potency of this ash. So this is the image of Ksharanirmana. Initially, we have to burn these plant parts. Then we have to collect the ash. We have to weigh that how much quantity of ash we have collected. Then we have to add water or gomutra or a mixture of both, and we have to macerate it well and kept for sedimentation. After a period of 12 hours, that is next morning, we have to take this supernatant liquid. We have to filter it through a three-folded cloth, and this filtrate is to be boiled over fire until the water particle is evaporated. So we can see the white pale white colored kshara is obtained at the end. We have to weigh the final product. So, if we consider Abhamarga Kshara as an example, it is a common drug, that is Aciranthus aspera, and it has wide application in disorders of related to ear, that is Badhirya Nashanaha. And there is a thaila prepared out of Kshara, that is Kshara thaila, in the context of Karna Rogas. Kharamanjariga ksharastikshnaha shwasanibarhanaha, and gulma shuladi rogatnaha. It will cure gulma, shula, etc. Also kamam baditya nashanaha. Baditya means hearing loss. So this is a common kshara that we are preparing in our practical classes. Then let's consider the properties of kshara. Not too tikshna, not too mild. Should be white in color, smooth and slimy, non-spreading in nature, wholesome and quick acting. According to Sushruta, Naivadi Tikshno na mrudu shuklaha shlakshno adapichilaha avishyanti shivaha shikraha ksharo hyashtagunaha smritaha. 8 qualities are therefore kshara. Charaga added lagu, vranapajana, vranavidaraga, dahakaraga, agni tipaka gunas to kshara. So let's consider the dosage of Kshara. It is mentioned as 2 to 8 gunja, that is 250 milligram to 1 gram. Dvigunjataha samarabhya rektika ashtaka samhitan Ksharastu viniyunjida sadharanataya bhishak. If we consider the difference between masi and Kshara, in case of Kshara, drugs are to be burnt, and we have to subject it for further procedures like dissolution, filtration, etc. In case of mashi, the drugs are only charred or carbonized. It is Kshara is white in color, mashi is black in color, and the duration is of procedure, if you consider, in case of Kshara it is more, and mashi we can prepare very much easily, and it contain more alkaline particles in case of Kshara, and carbon particles are there in mashi. And as I have already told you, that is, it needs dissolution, filtration, and evaporation in the procedure. And in case of mashi, we have to powder it and sieve through fine meshes. Now let's consider the most important therapeutical application of Kshara, that is Ksharasootram. Sutra means thread. So Kshara Sutra is a Kshara coated thread. Here, this is having application in the treatment purpose of hemorrhoid, fistula in ano, etc. For preparing Ksharasootranirmana, we require thread, that is surgical linen thread. Nowadays we are using number 20 surgical linen thread, and we have to be equipped with the Ksharasootranirmana cabin with hangers and hot air blowers. Again, we have to be equipped with the drugs like Snohi Kshira, Apamarga Kshara, and Haridra Churna. Snohi Kshira has to be collected within an hour of is to be collected in the early morning and used within an hour of collection. So this is the reference of Ksharasootranirmana from Chakradatta. Bhavidam Rajani Churnaihi Snuhi Kshire Punaha Punaha Bandhanad Sudridam Sutram Binatyasho Bagandaram. We have to do coating with the Rajani Churna and Snuhi Kshira repeatedly, and on tying this sutra, it will cure Bagandara and Arshas. So, if we consider the Nirmana Vidhi in detail, initially we have to perform 11 coatings with Snuhi Kshira. That is, one coating should be applied, it has to be dried, and then another coating should be applied. Like that, we have to repeat up to 11 coats. Thereafter, we have to apply 7 coats with a mixture of Snuhi Kshira and Apamarga Kshara. Then, after that 7 coating, we have to apply a mixture of Snuhi Kshira and the Haridra Churna repeatedly for 3 times. We have to take care that all parts of thread get uniform coating, and after each coat the hangers are placed back to the cabinet and hot air is blown to dry them evenly. This is the image of a Ksharasootranirmana cabin. So if we consider the packing and preservation, these threads are cut in 15 to 20 centimeter and packed in polythene bags, around 10 in a bag, and this is further sealed inside a glass tube with a silica bag to check moisture inside. If we consider the potency period, once broken, threads are used within a period of 6 months. With a unbroken seal, the threads stay potent for as long as 5 years or more. So this is the image of a Ksharasootranirmana packing, and how we are applying the note or tying the Ksharasootranirmana in case of anal fistula. We have to probe the tract, and we have to tie that, thereby the tract will be cut off, and healing will be occurring simultaneously. So that is the application of Ksharasootranirmana, and this is having much more advantage, that is the recurrence rate is much less when compared to the therapeutic intervention compared to the modern surgical interventions like surgical interventions. Okay. So this is all about Ksharakalpana according to the BMS syllabus. So you have to go through the preparation method of Kshara and the Nirmana Vidhi of Ksharasootranirmana, and the difference between the masi kalpana and the Kshara kalpana in detail. So that are the most probable questions from this part. Okay, thank you for your patient listening.